Standard angiographic views for right coronary artery are two views. Left anterior oblique view is best for demonstrating the ostium and mid portion of right coronary artery. You can see clearly that this is the ostium of right coronary artery. The bifurcation of right coronary artery into posterolateral branch and posterior descending artery is much better visualized in LAO view. The ostium and mid portion of the right coronary artery is seen on the left side of the screen in LAO view, and posterolateral branch is above the posterior descending artery in left anterior oblique view for right coronary artery. A right anterior oblique or RAO view is used for clearly visualizing the mid portion of right coronary artery. The extent of PDA is visualized as well in this view. You should not assess the ostium in this view because it is not well visualized in right anterior oblique view for right coronary artery. Left coronary artery has 5 views in which it is looked for: RAO caudal, RAO cranial, lateral view, LAO cranial view, spider view. LAO caudal view or spider view, it is very famous. It is very famous projection for the assessment of left coronary artery in LAO caudal view, and you can see the left main stem. This is left main stem. Here is its distal end. So you can clearly see the distal left main stem, proximal left anterior descending coronary artery, and proximal circumflex artery in the spider view. Ramus intermedius is also visible in this view. So distal left main stem, proximal of the LAD and proximal of circumflex are the major areas for which we do the spider view. Next important view for left coronary artery is RAO caudal view, and you can see that the distal part of the left main stem, proximal segment of left anterior descending coronary artery, circumflex artery and its branches can be clearly seen in RAO caudal view. So to recap, distal left main stem, proximal part of left anterior descending artery till its first perforator, circumflex artery and its branches can be clearly seen in this view, that is RAO caudal view. RAO cranial view. If you want to see the branches of left anterior descending coronary artery, then you will obviously opt for the RAO cranial view. So in the RAO cranial view, you can see that left anterior descending artery is there, and you can see its branches. Clearly diagonals are seen. D1, the first one is D1, the second one is D2. Till the septal perforators can also be seen, and you can see this portion of the left anterior descending artery very clearly on your screen. Lateral view LCA, LAO 90 degrees straight lateral view shows mid LAD and the circumflex artery. You can see that both LAD and circumflex have been separated apart in the lateral LAO 90 degrees straight lateral view, and left anterior descending artery is separately seen from the circumflex coronary artery in this lateral or LAO 90 straight lateral. If you want to see ostium of left mainstem and origin of diagnosis from LAD, then this view called LAO cranial view is best for it. Here you can see the ostium of the left main coronary artery as well as branches of LAD clearly in this LAO cranial view for left coronary artery.